Let's bring in for analysis Dr. Mohammed Munir, a virologist and lecturer at Lancaster University up there in the northwest of England. Dr. Munir, as ever, thank you for joining us here on France 24. We always appreciate your time. How optimistic are you for a vaccine?
I think it is certainly a good beginning, although there are a lot of questions still need to be answered because this is the first stage where dose and the safety are measured. But the real efficacy of this vaccine would only become clear once the phase 3 trial would become available, because that would be the time when we will be able to see whether the antibodies, those are induced by this vaccine, are neutralizing and they are protecting enough against the natural infection. But the results, these are really interesting and also considerable, because this is the first peer-reviewed study came out of the phase 1 trial for any vaccine. So it passed through a rigorous review process, and as it stands, quite a good immune response has been induced, and hopefully it would translate into neutralization against active infection.
This phase 3 testing starts on July the 27th. How long will it take? How long will it take until they know the results?
Yeah, that is a very interesting question, because the safety trial that is predefined, it's run for 2 or 3 months within the population. But when it comes to phase 3 trial, that is basically the last stage of any efficacy before the regulators will look into the data and approve for its marketing and making it available. That really depends how much is the disease prevalence in the population. For instance, when the phase 3 will be started, some people will be given a placebo treatment, others will be given the vaccine, and they will be asked to go into the field and live regular life. And then by nature, if they come up with the infection, and that is how they will be assessed whether the one those were vaccinated, they will be able to show resistance against the infection. So that can last up to 6 months, depending on the severity of the disease. So the current rate of infection is going high, and the number of volunteers they have recruited of 30,000. So in Moderna case, we are anticipating the results would become available around Thanksgiving Day.
Do you think, is there an assurance that when this vaccine is made, it will be available for everybody?
Well, one of the good things with the mRNA-based vaccine, such as Moderna, is that the scalability is really easy because there isn't any requirement for cell culture or the virus propagation. Everything is synthetic, so it can be scaled up quite quickly. Although the demand is so high, I don't anticipate that they will be able to make 7 billion doses all at once. That would meet the demand of the whole world. However, they have calculated and say that if the vaccine would approved by the regulator, they would be able to make 500 million doses, which could probably be sufficient for the most in need, for example, the frontline health worker or people who are really vulnerable to the infection.
Let's hope this speeds along. Dr. Mohammed Munir from Lancaster University, as ever, sir, thank you for joining us. We always appreciate your time and the analysis that you give us. And let's hope that the other labs, too, are making progress in their search for this COVID-19 vaccine. We'll, of course, keep you up to date with all developments. The new Prime Minister of France